Emergency aid continues to be deployed in Pakistan following the floods that swept through the country at the end of July. MSF teams are treating patients for pathologies resulting from poor living conditions or lack of food, particularly in the south of the country.
Our house, animals and things were destroyed in the floods. Now we are living in a tent. We have nothing. In total, we are a family of 8, 2 of whom are sick. This child has received treatment, so now I'll go home with him and bring the other one. The other one is younger and has the same illness.
Zinad's son is suffering from acute diarrhoea. He's been treated at an MSF diarrhoea treatment centre in Dera Murad Jamali in Baluchistan province.
Rehydrate the patients, so this may be either orally with ORS, oral rehydration salts, or if the patient is more severe, we will provide intravenous fluid administration. Certainly the best way for us to improve the situation is to provide clean drinking water and at the same time make sure that people have got early access to treatment.
Diarrhoea also aggravates malnutrition, a disease already chronic in certain provinces. Since the flooding, the nutritional situation has deteriorated even further. MSF has set up an intensive therapeutic feeding centre in Sukur in Sindh province, where the organisation's mobile clinics refer the most serious cases.
These children, this target of population, are more vulnerable to the cross infections, nosocomial infections, to become severe ill due to any other infections, especially diarrhea, pneumonia, upper respiratory tract infections, and these kind of diseases.
So far, 1,100 children have been treated for malnutrition on MSF programmes. In total, the organisation's medical teams have provided more than 40,000 medical consultations in 8 hospitals, 11 mobile clinics and 8 diarrhoea treatment centres. In addition, teams continue to distribute safe water and essential non-food items.
1 month ago, my son became ill with classic dengue. Dengue is dangerous. Dengue kills. It kills children. It affects people of every age and every social class. Anyone can get it.
In Honduras, more than 50,000 cases of dengue fever have been reported. The number of patients with the common form of dengue has significantly increased. However, the most alarming feature of this outbreak is the prevalence of dengue hemorrhagic fever, which has a mortality rate of more than 10%. More than 1,500 cases have been recorded since the beginning of the year.
Dengue is a viral disease transmitted by the Aedes variety of mosquito. On one hand, we have classic dengue, which can be treated at home as it doesn't have serious complications. If classic dengue has complications, it produces hemorrhagic dengue, which requires hospitalization.
To support local health services, MSF has set up an emergency ward for children under the age of 15 at the San Felipe Hospital on the outskirts of Tegucigalpa, the country's capital, where the majority of cases have been reported. Within 2 days, all 23 beds on the ward were occupied. Treatment consists of hydration and rest, controlling the symptoms and treating the consequences while waiting for the patient's condition to stabilise. There's no vaccine or specific medicine against the virus. However, treatment alone is not enough to fight the epidemic. It must be accompanied by a prevention strategy and education.
We start by raising awareness. We visit people's homes and try to explain where they can find possible transmission sources. We inspect the house, identifying potential places for larvae or cocoons. We destroy them together with the use of chemicals.
Having treated stagnant waters, MSF teams work with the Ministry of Health's vector control body to eradicate mosquitoes by fumigating homes. In the Mansion neighbourhood, where the highest rates of patients have been recorded, MSF has already intervened in 700 homes and plans to fumigate a further 4,000. Niger is once again in the grips of a nutritional crisis. The situation is acute, but 2010 is particularly serious. This is a country where 1 in 6 children is undernourished. Médecins Sans Frontières has already treated over 75,000 children suffering from severe acute malnutrition. In July, teams put a new strategy in place by adding prevention to its programmes in order to reduce the number of cases of malnutrition. This includes the distribution of a ready-to-use food supplement.
It's 250 calories and provides all the macronutrients a child needs to grow properly. It comes in small pots. You should give a spoonful in the morning, one at lunchtime and another in the evening. With that, the child receives all the macronutrients he needs, plus 250 extra calories. And then there is the family meal to complete.
In the region of Maradi, women from surrounding villages assemble for the food supplement distribution. They are given a 1-month supply of 4 pots and come back again the following month. But malnutrition remains a recurring problem, and combating it calls for the devising of sustainable solutions. Fighting in Yemen's northern Saada governorate continues. Since March, following the displacement of 28,000 civilians to neighbouring Amran, MSF has been providing support in 3 different Ministry of Health facilities. Although the situation of the displaced has stabilised and half of them have returned home, medical needs in the Amran governorate remain high. Endemic diseases such as malaria, diarrhoea and child malnutrition are rife amongst its 900,000 inhabitants. In the Kama District Hospital, MSF is working in the emergency and inpatient services, providing free medical care, drug supplies and medical equipment. Since MSF has been working in the hospital, an average of 15 new patients are admitted every week, and the number of emergency cases has doubled. A nutritional centre has also been opened.